Our goal is your satisfaction. Let us show you the way.
How much do you bleed with a miscarriage? It is normal to bleed for anything up to 7 to 10 days. It is not usual to bleed or have pain for longer than 3 weeks after a miscarriage. If you still have symptoms after 3 weeks, you should be reviewed. If the bleeding becomes heavier or smells offensive, you should consult your GP. How do I know if it's a miscarriage or just bleeding? It is important to see your doctor or go to the emergency department if you have signs of a miscarriage. The most common sign of a miscarriage is vaginal bleeding, which can vary from light red or brown spotting to heavy bleeding. If it is very early in the pregnancy, you may think that you have your period. How do I know if I'm miscarrying? Symptoms of a miscarriage. The main sign of a miscarriage is vaginal bleeding, which may be followed by cramping and pain in your lower abdomen. If you have vaginal bleeding, contact a GP or your midwife. Most GPs can refer you to an early pregnancy unit at your local hospital straight away if necessary. How does a miscarriage tissue look like? If you are less than 8 weeks pregnant when the miscarriage occurs, the expelled tissue will look no different from heavy menstrual bleeding. If you have reached 8 to 10 weeks, more tissue will be expelled, which can resemble large blood clots, possibly some pinkish, grayish material, or even a discernible sac. What color is the blood when you miscarry? Bleeding during miscarriage can appear brown and resemble coffee grounds, or it can be pink to bright red. It can alternate between light and heavy or even stop temporarily before starting up again. If you miscarry before you're 8 weeks pregnant, it might look the same as a heavy period. Raj. 20/1440 What do miscarriage clots look like? From 16 to 20 weeks, this is often called a late miscarriage. You might pass large shiny red clots that look like liver as well as other pieces of tissue that look and feel like membrane. It might be painful and feel just like labor, and you might need pain relief in hospital.
Take our lead. Let's help you make your mark.